Here at Swaay.Health, we love digging into new products and new features that improve the patient experience. When we heard that Televox, a company that has been in the patient engagement space for over 20 years, rolled out a new agent chat feature, well, we just had to find out more. We reached out to the company, and Vijay Verma, the Vice President of Product Strategy, agreed to come on the program to tell us more. Let's get to it.
Swaay.Health.
Vijay, welcome to the program.
Thank you. Thanks for having us.
I'm excited because this is the first time we're sitting down with someone from Televox, and you've got some new functionality that I'm anxious to ask you about. Before we get there, Vijay, can you give us a little bit of background of your role and then tell us a little bit about Televox?
Sounds good. Let me start with the Televox first. Televox is a patient relationship management company. We've been in business for 30 plus years. We serve close to 5,000 odd customers of medical practices of various sizes in the United States. And last year alone, we had a touch point with close to 70 million unique patients, sending over 2 billion unique notifications in the last year alone. My specific role in Televox, I'm head of product management for the enterprise segment, which covers mid to large size healthcare institutions and also spans into payer and the pharma space. Specifically, I cover a product portfolio that is infused with AI because we are looking at leveraging AI and automation in improving healthcare outcomes, operational outcomes, and first and foremost, improving patient experience with every interaction that we have.
Well, thank you for that. And of course, I see Televox all the time at the various conferences that I go to and know that you're definitely in the patient experience space and do a lot of good work for your clients. So I'm excited because you recently came out with an announcement about this new thing, which you call Agent Chat, I believe.
Yes.
Can you tell us what that is?
Yeah, absolutely. So, if before I get into agent chat, the couple of steps back, a lot of the industry has focused on proactively reaching out to patients, right? We send them reminders around, you're due for colonoscopy, you have an appointment in 3 days. Are you going to confirm? Are you coming for the appointment? Yes or no? You just had a visit with us. Can you fill in this survey? So this was a norm, I would say, until 5 odd years ago, right? There was, a lot of the vendors provide the solution. What the other half of the solution is patients have questions of their own. And historically, the only option was call this phone number. And as we all know, the phone lines are tricky business. You don't necessarily know how long the wait time is going to be. Will you get the right person on call or not? So, gradually Televox kind of moved into, let's make it a two-way street. So that's why the emphasis on patient relationship management as opposed to a SMS notification channel, right? So patient relationship means it needs to be a two-way street and it needs to work for patients as much as for the healthcare institutions. And obviously, for the questions that the patients have, some can be automated and some cannot be, right? So for the sake of this conversation, I'm going to skip on the self-service part, which is a key aspect. But there are questions that cannot be automated by a technology, and it needs patient to talk to someone on the other side, whether it is an operational question like, hey, I need help booking an appointment, or it could be that you have a patient who is enrolled in a care program and now needs to have a conversation with a nurse that is monitoring that pool of patients. And that is where agent chat comes into play. It's a secure experience that ensures that patients have easy access and a digital way of communicating to a staff from the hospital or a medical practice that can advance where the patient is in their journey.
So if you run me through a scenario, is this where a patient would be interacting with this person, but digitally? So I may have started my journey, digitally on the website, but now I'm actually chatting with a provider, a nurse, a clinician, somebody who may be running the program through a chat interface. Is that kind of sum it up?
Yeah, not a provider per se. Like it
Okay.
will not, you will not be talking to a physician on the other side. You
Ah,
likely will not be talking to, but you may be talking to let's say a call center staff who's going to help you book an appointment, right? Or you may be talking to a nurse, knowing that that you are in a care program and you may have questions around your symptoms or prescriptions. But this is not necessarily a provider communication. It is purely
gotcha.
for operational conversations. For clinical conversations, we do tend to defer that to the patient portal, which because it needs to tie into the medical record.
You're right. You're right. Okay, great. Thank you for clarifying that. That's very helpful.
Yeah.
So what sort of improvements will your customers realize from implementing something like Agent Chat?
Yeah, great question. So, there are a couple of, so one thing that we should, like understand is healthcare is a multi-party setup. There's patient involved, there's a physician involved, there is nursing involved, there are patient experience, officers involved. So we need a solution that, that works for multiple parties and on multiple levels, right? So that's kind of like where agent chat comes into play. First and foremost, it improves the patient experience because not everyone wants to make a phone call to get their questions answered because of the anxiety around, how long they'll have to stay on hold, right? It is, you don't know, like sometimes, you've seen this from flight or hospitality industry, the wait time can be 30, 40 minutes and you don't want it, but you kind of fear it, and that could prevent a patient from making a phone call, which is really needed for their care to advance, right? At the same time, you want a solution that is operationally efficient for an institution to run because it is really hard to retain, to recruit, and to provide excellent customer service people who can answer every phone calls 24/7, right? So, it needs to be a solution that is efficient and at the same time, something that does not increase the staff burden, right? So that's kind of like, why agent chat becomes important. And these are the problems that we are addressing to find a sweet spot that works for the patients, it works for the staff, and it works for the institution. And that would be the win-win-win. And that's kind of the product, vision and the approach behind this.
As you look at your product, the solution, are there any specific use cases or specific situations where you believe this is going to be the best option?
Yeah, yeah, absolutely. So let me, like tell you one thing where it is absolutely like not efficient. Okay, so I used to work for a hospital system before, and the common, the understanding was, let's say there is a sick child, right? There is no amount of technology you can put in front of that mother, which will encourage her to use that technology as opposed to talking human, right? So there are scenarios where we know that, digital chat is not the way forward. But that said, there are number of use cases in the healthcare scenario where chat would really be ideal, right? So for example, in the broad spectrum is where you need a convenient and a quick response where privacy is key. So clearly in those scenarios, chat will be a standout experience for automating routine follow-ups, for handling appointment scheduling, or confirmation of benefits, right? For non-urgent medical or operational natures. Like these are the kind of like scenarios where chat would be a much better experience than a voice-based interaction or a patient portal messages going to to the staff.
Gotcha. Well, thank you for sharing those. I want to ask you a very broad question, Vijay, if I could. Given that you are in the patient experience space,
Mhm.
given the people that you interact with, your customers, what are some of the challenges that you're seeing right now is a burning issue for the industry in terms of patient experience and patient engagement?
Yeah. I think staff burnout is one of the most pressing issues that we have. And whether that is a cause or correlation, access to care becomes an equally important factor as well, right? And those are the kind of like two things that we have to address. Everybody does deserve access to right quality of care at their convenience without having to jump through hoops, without burdening whoever is on the other side, right? It should be easy and quick for someone to book an appointment, but right appointment with the right provider through the right modalities. But broadly speaking, I'm oversimplifying, but if I have to like pick two, I would say staff burnout and access to quality care as the most pressing issues that we have to solve for in our current landscape.
Yeah, no, can't argue with you there, right? I mean, and burnout takes many forms, right? We're not just talking about people who are at the point of quitting. That's pretty extreme. But just burning out in terms of, hey, like I'm so burdened with administrivia, I'm so burdened with the pressures of the job that I may not be at my best all the time, right? And we know patients nowadays, and I don't think they expect the best every time, but they do expect a certain level of courtesy, respect, from their caregivers. And when you're not your best, sometimes it's hard to deliver that. So, no
I,
doubt, I think it's a big challenge.
Yeah, I couldn't agree more. And you may have heard me say this, like healthcare is one vertical where experience and outcomes both matter, right? It's not a question of one or the other, right? If you go to a restaurant, experience matters. There's not much of an outcome associated with it. If you go
Right.
to the gym, outcomes matter. Experience, you could, deal with it. You can look past that. But in healthcare, experience and outcomes both matter, and that is a sweet spot we have to find, right? And that's where technology comes into play.
I love how you put that, Vijay. What else is Televox working on? What are some of the other exciting things that you've got in store?
Yeah, I mean, modestly speaking, we've all been in the LLM, large language model, automation world, and we are working aggressively to bring all these concepts into all of our entire product portfolio, but very focused, centered around patient experience and staff efficiency. Right? This is not for the sake of bringing technology for the sake of it, but it is to essentially have that win-win-win, something that works for the patients, work for the institution, and works for the staff. But you will see like agent chat is kind of like a stepping stone in the direction where we think this can become an entry point to multiple technology innovations into healthcare, right? And that's how you will see it. And other thing that we are actively promoting is products. These are not so virtual agent chat are not destination products where we see the strength is embedding them into all our products and experience seamlessly, so patients naturally discover them, as opposed to telling them, if you want this service, call this phone number. If you want this service, go to this URL. So, as I said, like we fully intend to include AI automation in all our entire product portfolio going forward. And that's what you will see more from Televox in the coming months.
I mean, I'm glad to hear it. I mean, for you and others in the industry, I mean, all of us as patients are after more seamless interactions, right? And it sounds like with your agent chat and with other technologies, you're really trying to make this 100% seamless. Whether I'm talking to an agent, whether I'm dealing with the website, whether I'm dealing with the organization on my phone, you want it to be as seamless and as helpful as possible.
Absolutely.
Amazing. Well, Vijay, last question for you. Where can people go to learn more about Televox?
Well, our website is absolutely one-stop shop to answer these. If you go to televox.com, we have we mentioned about our own product portfolio. We also have case studies around how other hospital systems have used agent chat to improve that dramatically improve operations associated with before and after agent chat, and you have customer testimonials, and you obviously have an easy way to contact our sales team to learn more about our upcoming webinars and also to learn about our products.
Well, Vijay, thank you so much for sharing the information you had today. It's a pleasure to have you on the program.
Likewise, happy to be here and represent Televox's point of view.
I want to thank Vijay for coming on the program to talk about Televox's new feature and his observation about the challenges to improving patient experience. I agree 100% with him. Anything we can do to reduce the workload on healthcare staff, frontline and back office, is important right now. You can't expect people who are feeling stressed to deliver a good patient experience. And hey, if you enjoyed this interview, help us out by mashing that like button and subscribing to our channel. Also, head on over to Swaay.Health, that's Swaay with 2 A's, .health, where you will find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.